the integrated teaching, the module we have chosen was the tuberculosis. So while preparing this module, I found there is a famous quote by Mother Teresa. The biggest disease today is not leprosy or tuberculosis, but rather the feeling of being unwanted. So this is a famous quote which attracted me. So I will be talking on a tuberculosis, module on tuberculosis. So this is very common disease, will be routinely encountered. So it is also termed as pox disease. So what is our intention? So at the end of this session, the student should understand the etiopathogenesis of tuberculosis, the morphology of important organs affected by the tuberculosis, laboratory diagnosis of tuberculosis, and the salient clinical features of a tuberculosis, and ultimately the management of a tuberculosis. So I will be talking about etiopathogenesis and the morphology. The laboratory diagnosis, it will be dealt by Dr. Sanjeev, who is from the Department of Microbiology, and the clinical features and management, it is by Dr. Rajesh, who is a pulmonologist. Let me start with this tuberculosis. So it is one of the common, it is a slide we will be putting for inflammation factor. The nature heals and physician just assists. But many times we will be facing this challenge. The nature, it is taking its own time for heal, and a physician will be struggling for, so it is curing the disease. So one of the example is the tuberculosis. If you look at the clinical scenario of this tuberculosis, so it is a very alarming and very important. So it is affecting around, it is a very prone people, so many people are very much prone. So around 1/3 of the world population, we are under the risk of developing this tuberculosis. And every year, or there will be 3 million or more deaths because of tuberculosis. And it is a very rampant disease, it's a very important communicable disease. And since 1985, once we discovered this HIV, so this is one of the important, it is associated with this HIV. It is almost like a colonial cousins, HIV and tuberculosis. Just like hypertension and this diabetes, how it is both. Generally, it is a simultaneous blockage. So this HIV and this tuberculosis, very strong assistance it is having. So what is the causative organism? So it is caused by this mycobacteria species. Mycobacterium. So what is the speciality of this? So it is one of the bacilli. What do you mean by bacilli means? It is a rod-like. Okay, it is a rod-like. So it is aerobic and normotype, which is not producing toxins. Generally, all gram-negative, gram-positive bacilli, it will be secreting toxin. It will not secrete toxins. What is the organism which is specifically cause tuberculosis? In humans, it is a Mycobacterium tuberculosis. In cow, if it is transmitted from the cow, it is a Mycobacterium bovis. And there is something called as atypical mycobacteria. So what are the important mycobacteria? Atypical mycobacteria, there is a long list. So what are the important? So Mycobacterium avium, Mycobacterium intracellular, Mycobacterium kansasi. So there are big list of atypical mycobacteria. So this is how it is a conform. What is the unique features of this? It is acid-fast bacilli. So it is an acid-fast bacilli. So if you diagnose this tuberculosis based on identification of acid fastness, in the routine setup we will be identifying based on acid fastness. So this is how this organism will be seen, which is having beaded appearance. What are the salient findings of this? So it is always depends on the immune system of the person. If you are not getting any tuberculosis means your immune system is good. If you are prone for if you are having tuberculosis means immune system is poor. So it is very determined by the immune system of the body. Immune system. If immune system is good, so generally we are less prone for developing tuberculosis. If your immune system is poor, you will be very much prone for developing this tuberculosis. So where it is very common. Already wherever there is immune system is going down. So what are the common conditions? So this HIV. So this is a HIV. So immunosuppression states. Immunosuppression states. So apart from that, so there is a poverty or overcrowding. It is almost like God's gift to India. So all these are very rampant. So this is pulmonary tuberculosis and extrapulmonary tuberculosis, very common in Indian setup. How it is transmitted? So most common transmitted mode is by inhalation routes. So apart from that, so it is because of ingestion of contaminated milk. So it is caused by Mycobacterium bovis. It will be by ingestion, it will be causing a pulmonary tuberculosis. Most common mode of transmission is inhalation. So how it is spread to different parts of the body? Either because of local spread, or because of lymphatic spread through the lymphatic channels, or because of hematogenous. What do you mean hematogenous? Through the blood. It is transmitting through the blood. Or maybe miliary spread. Miliary spread. What is a miliary spread? It is a specific type of spread. Miliary tuberculosis. Miliary spread. Or wherever there is a natural passages. Through the natural passages, it will be transmitted to the different parts of the body. So it is what are the organs which is affected by the tuberculosis? It is commonly affects the lung. Commonly affects the lung. What are the other organs which will be affected? So this, whenever tuberculosis is affected, so it is affecting the lung, that it is called as a pulmonary tuberculosis. Pulmonary tuberculosis. What are the other organs which will be seen? Already I said, it is a nose anatomy better. Its nose anatomy better. So it can affect each and every organ of the body. So what are the common sites? So it can be maybe CNS, or maybe lymph node, or intestine, or genital tract, any of this side. Any of this side. Almost there is, we can say, so there is no other organ in the body, no organ in the body will be spared because of tuberculosis. So it knows anatomy better than even medical student. Why it is so special and why it is so challenging? Because of certain factors which is there. So there will be something called as virulence factors. What are the virulence factors? By which it is giving challenge and it will be causing pathogenesis. What are the virulence factors? So it is having something called as POD factors. It is having what is called as sulfatide factors, and there is something lipoarabinomannan. So what it will do? It will try to dominate over the macrophage. It will try to dominate over the macrophages. So whenever there is a inflammatory cells are there, so it is a try to dominate over the inflammatory cell, and it will be easily flourish in this. It is a dominate over the immune system, and it will flourish in the body. So all these factors, POD factor, sulfatide factor, and lipoarabinomannan, and even recently we found there is some invasive genes. So certain genes which is responsible for the dissemination of tuberculosis. So how it will be causing the disease? What is the basic pathogenesis of this? One of the common organ which is affected is the tuberculosis, or it is the lungs. So it is through the inhalation route. Commonly it is called as inhalation route. It will enter into the lungs and it will affect the alveoli. It will be affecting the alveoli. And so it is macrophages immediately come to the site, and it will try to engulf. But because of certain virulence factors, it will dominate over the macrophage system. It will grow rapid manner, or it will be rapidly it will be grows. And also it will elicit type 4 hypersensitivity reaction. Type 4 hypersensitivity reaction. So it is one of the cell-mediated immune response. Cell type 4 hypersensitivity reaction. So because of this type 4 hypersensitivity reaction, it will elicit, typically there is something called as a granulomas. Okay, there will be formation of granulomas. If you are a second year student, if you don't say, when we say it is a tuberculosis, if you don't say it is a granulomatous inflammation, you are failed. So it is a very important organ. It is a very important cause for a tuberculosis. Very important cause of granulomatous lesion. So how it will be? What is a granuloma means? What is a granuloma means? And how it is formed? So look at this. So these macrophages, it will be activate some of the T cells, and by which it will be transformed into what is called as activated macrophages, activated macrophages, and this activated macrophages attain a shape of what is called as epithelioid cells. Epithelioid cells. What is epithelioid cells? It is basically modified macrophages. Modified macrophages. And also we can appreciate epithelioid cells. Apart from that, we'll be seeing what is called as Langhans giant cell. What is Langhans giant cell? It is just like one you can't face, and there will be generally it will join together and it will form what is called as a giant cell. Langhans giant cell. Particularly it is very common cause or very common giant cell. It will be seen in a tuberculosis. Langhans giant cell. Apart from that, in the center what you are seeing, there will be presence of a caseous necrosis. Caseous necrosis. So whenever you are getting caseous necrosis, epithelioid cells and Langhans giant cell, it is caused by a tuberculosis for you. Tuberculosis for you. How it is be seen? So it is already, remember, the granulomatous lesion. Granulomatous lesion. So what is a granuloma? Is composed of basically, it is centrally there will be presence of caseous necrosis. What do you mean a caseous necrosis? It is almost like a cheese. It is almost like a cheese-like material, necrosis, and it is surrounded by epithelioid cells. What is epithelioid cells are? It is a modified macrophages. Modified macrophages. And there is a presence of Langhans giant cell. What is a Langhans giant cell? It's epithelioid cells. It will join together and forms Langhans giant cells. And there will be rim of lymphocytes and fibroblast or fibrosis. So all this constitute what is called as a granulomatous lesion. How it is we see? Can you identify this organ? What is the organ this is? Can you identify this organ? Lung. What you are seeing? You are seeing the numerous alveoli. So what you are seeing? Apart from the alveoli, you are seeing many granulomas. So how it is? What is this granuloma is composed of? So you can note down. So there is a presence of what is called as epithelioid cells. There is a presence of epithelioid cells. And what else you are seeing? You are seeing in the center caseous necrosis. Presence of caseous necrosis. Central caseous necrosis. What else you are seeing? So there is a presence of one giant cell. What giant cell? Langhans giant cell. How will you identify this Langhans giant cell? What is the peculiarity? You can identify the nucleus in the periphery. It is in the form of horseshoe shape. Okay, horseshoe shape. So what are the salient findings of a granulomatous lesion now? So it is a composed of epithelioid cells, caseous necrosis, and Langhans giant cell. Of course, it is surrounded by lymphocytes. So whatever the organ it is, whether it is pulmonary side or extrapulmonary side, so if you are in the biopsy or in the histology, if you see this, it is a tuberculosis. Okay? If you see this, it is a tuberculosis. So one of the diagnostic method is a tissue biopsy. If in the tissue biopsy, if you are seeing this, it is a tuberculosis. Okay? It is a salient findings of a tuberculosis. What are the common findings? What will be seen within the tuberculosis? Whenever it is affecting the lung, we can get several types of infections. One is called as, what we say, it is an active infection. Active tuberculosis. What is active tuberculosis? So it is an unhealthy person. It is occurring in an unhealthy person. What do you mean unhealthy person? Immune system is not good. Immune or immunocompromised patients. Bacilli overwhelm immune system. It will be dominating over the immune system. Okay? So it is you can get what is called as an active infection. So immune system is poor and bacilli dominating over the immune system. So you will be getting active infection. So also you can get what is called as a latent infection. What do you mean by latent infection? So initial infection, it is controlled by the immune system, and this bacteria, it will be in the center and it is surrounded by, so there will be something called as a guarding. So whenever immune system is very strong, so it is a bacilli somehow, it will remain within the tuberculosis. And whenever immune system goes down, that time, so this bacilli, it will dominate and it will cause an infection. So this is called as a latent infection. Bacilli will remain confined to the tubercles for years. Whenever it will be given the chance, or whenever immune system goes down, in such cases, we will be getting a tuberculosis. the clinical spectrum of disease when we talk about this tuberculosis? Whenever we say it is a pulmonary tuberculosis, so we can get what is called as primary tuberculosis, primary pulmonary tuberculosis, or secondary pulmonary tuberculosis, secondary pulmonary tuberculosis. So what do you know primary pulmonary tuberculosis? So occurring tuberculosis for the first time, previously unexposed or unsensitized person. So in such cases we'll be getting primary pulmonary tuberculosis. Primary pulmonary tuberculosis. When you get a secondary tuberculosis, it is a previously sensitized. Previously patient had tuberculosis, somehow it is treated, and again you are getting infection. It is called a secondary tuberculosis. Secondary tuberculosis. So why it is? What is the basic reason? It is a reactivation of what is called as a latent infection. Reactivation of the tuberculosis, or exogenous reinfection. Again patient is getting infection. So in such cases we can get a secondary pulmonary tuberculosis. Secondary pulmonary tuberculosis. So when you talk about this primary tuberculosis, you should remember there is something called as complex. What is a complex means? Complex means multiple findings. Gone complex, or also termed as primary complex. So what is what is the salient finding of this? It is occurs in primary pulmonary tuberculosis, Ghon's focus or Ghon's complex. What it is composed of? So there is something called as Ghon's focus, there is something called as lymphatic component, and there is lymph node component. So these three findings constitute what is called as Ghon complex or primary complex. What are the findings of Ghon complex now? So there is a Ghon focus, there is a draining lymphatics and lymph node. Okay, lymph node. So what is Ghon focus means? So it is located, it is a subpleural focus, just below the pleura, part of the lung, just below the pleura. And where it is? Upper part of the lower lobe and lower part of the upper lobe. So this particular area, you can understand. So this is the picture. You can note down. So this is the subpleural location. You can note down. So there is some foci. So it is a subpleural location. It is called as occurring in the upper part of the lower lobe and the lower part of the upper lobe. So this is called as a Ghon focus. Anything else? You can make out something. What is this? It is a lymph node. What is the lymph node? It is a draining lymph node. What is the lymph node? Hilar lymph node. Okay, hilar lymph node. And also there will be something called as lymphatic drainage. So these three things constitute what is called as Ghon complex or primary complex. Once this happens, what will happen next? What is the fate of this primary tuberculosis? It might undergo heal by fibrosis or may undergo calcification. Undergo healing by fibrosis or calcification. It will progress for a progressive pulmonary tuberculosis, which is remained in the some part of the lung, which is gradually disseminated to the other part of the lung. It is a progressive pulmonary tuberculosis or primary miliary tuberculosis. What is a miliary tuberculosis means? It is a spreading all over the body. So progressive miliary tuberculosis, or maybe we can get a secondary tuberculosis. What is the fate of primary tuberculosis now? It may undergo fibrosis or calcification, or may go for progressive pulmonary tuberculosis, or maybe primary miliary tuberculosis spread to the other part of the lung, other part of the body, or secondary tuberculosis. What do you mean by this? Secondary tuberculosis means. So it is basically which part of the lobe is affected. Most of the time, what you are seeing the patient, it is of secondary tuberculosis. So by which lobe is affected? It is a preferentially affect apical lobe. Apical lobe of lung. So you can make out. So it is most of the clinical presentation. It is seen affecting the primary or the apical lobe. So secondary tuberculosis, one of the common mode of presentation, which is predominantly affecting the apical lobe. What is the fate of this secondary tuberculosis? It will again, this secondary tuberculosis, it will heal by fibrosis, or maybe we can get a Formation of cavity. So this is a cavity formation. So that is also one of the salient finding of secondary tuberculosis. Fibrocavitatory tuberculosis. Fibrocavitatory tuberculosis. Or presenting as pneumonia, tubercular pneumonia. Presenting or complicating into tubercular pneumonia. Or miliary tuberculosis. It will disseminate to other part of the lung, other part of the body, miliary spread or miliary tuberculosis. Or may presenting with a pleural effusion. Pleural effusion. So these are the fates of secondary tuberculosis. Secondary tuberculosis. So this is the picture. Which lobe is affected here? Which lobe is affected? Apical lobe. What else you are seeing? You can note down. It is a completely distorted. There is a formation of cavity. So this is one of the common mode of presentation of secondary tuberculosis. Secondary tuberculosis. Next is something about progressive primary tuberculosis or progressive pulmonary tuberculosis. Again, the immune system is playing very important role. Immune system is very poor. In such cases, gradually it will disseminate other part of the lung and it is produce what is called as a progressive pulmonary tuberculosis. Okay, it is presenting with maybe pleural effusion or maybe empyema or maybe it is affecting all part of the lung. It is called as a progressive pulmonary tuberculosis. Progressive pulmonary tuberculosis. Other type of tuberculosis is what is called as miliary tuberculosis. What is a miliary tuberculosis? It is a spread of this bacilli through the lymphatics or in the form of millets or millet seeds. The spread in the form of millet seeds. So these lesions will be producing very small lesions. Very small lesion. Almost every organ is affected by this miliary tuberculosis. So miliary tuberculosis, generally immune system is very poor. In such cases, it will be affecting all part of the body and it is a seen like, it is a very microscopic or small foci. Okay, it is a resemble like a millet seeds. Millet seeds. What are the other organ? Almost every organ, liver, spleen, kidney. So it is a fallopian tube, genital tract. Almost every organ is affected. So it is called as a miliary tuberculosis. Miliary spread. So what is this organ? What is this organ? Spleen. Okay, this is spleen. So you can note down. So there is miliary spread. You can note down. So there is a multiple foci of a spread. So it is a miliary tuberculosis. A finding of miliary tuberculosis. What is this organ? Lung. You can note down. So again, almost every organ, every lung field. So there is some foci of tuberculosis. So it is called as a miliary tuberculosis. Miliary tuberculosis. So it is affecting whole part of the body. What is this organ? What is this organ? Maybe liver or maybe spleen. You can note down. Again, there is a multiple patches. Again, finding of the miliary tuberculosis. It is a salient finding of the tuberculosis or miliary tuberculosis. Miliary tuberculosis. So what I said just now in the pulmonary tuberculosis, remember, you can get infection and it will form the primary complex or primary tuberculosis, may undergo healing by fibrosis or may complicate or may progress into progressive pulmonary tuberculosis or may progress into secondary tuberculosis, or if immune system is very poor, it will go for a miliary tuberculosis. It will be going for a miliary tuberculosis. Again, summarizing the pulmonary tuberculosis, so it is causing primary complex or primary tuberculosis. If everything is fine, immune system is good, it will heal by fibrosis. If it is not healing, it will go for a miliary tuberculosis, or it is goes for a progressive pulmonary tuberculosis, or may it will go for secondary tuberculosis or complicate into a miliary tuberculosis. Complicating into miliary tuberculosis. What are the other organ is affected? So this is termed as extrapulmonary tuberculosis. Extrapulmonary tuberculosis. What are the common organ it is affecting this extrapulmonary tuberculosis? It can affect almost every organ. It can affect any organ. What are the common organs? Meninges, CNS, encephalitis or meninges, or maybe kidneys, adrenals, bones, fallopian tube, lymph nodes. So it will cause almost every organ affecting, causing extrapulmonary tuberculosis. when we talk about this meningitis or CNS tuberculosis, so it is commonly manifested in the form of two. What is the common manifestation? It will be producing inflammation of the meningite or meninges. It is called as tuberculous meningitis. Tuberculous meningitis. The patient will come with meningitis features. Patient will be coming with meningitis features. Maybe in the child or in the adult. If you see the meninges biopsy, again we can identify this granulomas. We can identify this granulomas. For identification of meningitis, what you are supposed to do? What you are supposed to do? Lumbar puncture. Okay, lumbar puncture. You can note down. So there is a gross appearance. So meninges is very much thickened and it is affected because of tuberculosis meningitis. So this is how the CSF on gross examination will looks like. Something it is resemble like thread. Okay, it is a cobweb appearance. Okay, it is called as a cobweb appearance. It is a characteristic finding of a tubercular meningitis. Cobweb appearance. What are the tests you are supposed to do in the lumbar puncture? You are supposed to do varieties of tests. Varieties of tests. So whenever CSF is provided, you are supposed to perform some tests to know commonly whether it is caused by pyogenic or viral or tubercular or maybe because of fungal. What are the salient findings of tubercular meningitis? So generally CSF pressure, it will be increased CSF pressure, or so there is some protein and sugar. It is suggests that it is an exudate nature. It is an exudate nature with high protein and low sugar. And if you do the total count of this CSF, generally it is high. And if you do the differential count of this, what will be the predominant cells will be seen in the tuberculosis? It's commonly lymphocytes. Commonly it is a lymphocyte. And if you look at the CSF to serum sugar ratio, generally it suggests that it is a decrease. Okay, it is a decrease. So this is all the salient findings of this CSF tuberculosis, CSF finding. Repeat. So what will be the finding? So gross examination, cobweb appearance, CSF pressure, it will be increased, CSF protein is increased, sugar will be decreased, suggests that it is exudate, and if you do the total count, it will be very high, and maybe if you do the differential count, predominantly it is showing the lymphocyte. So this is the finding of CSF, which is showing predominantly lymphocytes. In Indian setup, one of the common cause for lymphocytic cell or lymphocytes in pleural effusion, and in cases of this CSF, it is because of tuberculosis. What is the other one more form of this tuberculosis? It will manifest as space occupying lesion. So this is termed as tuberculoma. What is a tuberculoma means? Oma means it is a tumor. This tuberculosis manifested as a tumor, tuberculoma. So you can note down the CS or CT finding. It is looking like some space occupying lesion, which is resemble like a tumor. On the gross examination, can we make out there is the mass-like area. So this is also one of the other form of CNS tuberculosis. So presenting as mass, tuberculomas, Apart from that, it will affect lymph nodes. One of the common in the routine setup, we will be seeing more commonly a tubercular lymphadenitis. So it is the most frequent form or most frequent extrapulmonary form of tuberculosis. Commonly they will be manifested as enlargement of the cervical lymph nodes. So if it is immune system is very strong, they might come with only one lymph node, isolated lymph nodes. If the patient is having HIV positive or immunocompromised, they will be presenting with multiple lymph nodes or in the form of, to the extent of generalized lymphadenopathy. So maybe the cause for a generalized lymphadenopathy. How it will be presented with? So this is the typical presentation of this. You can note down the characteristically on palpation it will be described as matted. Okay, they will be presenting as matted lymph nodes. Okay, this is the gross examination. How many lymph nodes are there? So this is one lymph node, this is another lymph node, multiple lymph nodes matted together. So it is one of the characteristic finding of a matted lymph node. What else you are seeing? In the center there is some yellow material. What is this? CC material. Okay, caseous material. So it is a characteristic finding of tuberculosis. Again, one more finding. So multiple lymph nodes matted together. It is a matted appearance. Okay. What you are supposed to see? Again, granulomas. Whatever the tissue is there, if you are seeing a granuloma, it is showing all findings what I said. A granuloma, a caseous necrosis, epithelioid cell, Langerhans cell, or fibrosis. It is suggests that it is a tuberculosis. It is one of the common form, a tubercular lymphadenitis. Next is other common form is intestinal tuberculosis. Where do you get intestinal tuberculosis? One of the common causes swallowing of a sputum. Swallowing of the patient of pulmonary tuberculosis. A sputum patient is having a pulmonary tuberculosis, he swallows continuously this sputum, or maybe because of contaminated milk, swallowing a contaminated milk. What is the organism? Mycobacterium bovis. Okay, so swallowing of the crushed sputum. Which part of the intestine is affected? Commonly, it's a commonly affecting. So ileocecal region, because of there is a natural obstruction, so it will be produces almost like a stagnation state in the ileum, and it's commonly manifested with the ileal lesion. They will be presenting with the ileal lesion. What are the common typical lesions you are supposed to identify? So this is the intestine. Can make out there is some ulcer. So this is the ulcer. What is the typical ulcer described for tuberculosis? It is typically produces transverse ulcers. Okay, transverse ulcer. So you can identify transverse ulcers. One of the common DD or common differential diagnosis, you can get a ulcerative form of tuberculosis. Apart from that, you can note down. So this is the intestine. When we go, there is something. So there is a multiple tubercles. You can identify formation of multiple tubercle outside. So this is also one of the other manifestation of tuberculosis. What are you supposed to see? Again, irrespective of the organ, you are supposed to identify a granulomas, caseating granulomas. Even in the intestine, you are seeing a caseating granulomatous lesion. What are the other organs affected? Tubercular osteomyelitis. One of the common form of getting a tuberculosis. What are the common bones are affected? Commonly affecting the vertebra, spine, thoracic vertebra or lumbar vertebra, or knee bones or hip bones. They will be presenting with the arthritis. They will be manifested with the arthritis. So generally they will be produces destructive lesion, destroying the bones, destroying the lesion. What is called as port spine? What is a port spine means? Tuberculosis of the vertebra. Okay, tuberculosis of the vertebra. So port spine will be manifested with the port spine. And one of the common mode of presentation, presenting with the discharging sinuses. So patient is having bone infection or bone tuberculosis and manifested as multiple discharging sinuses. They will be presenting with the discharging sinuses. Or they will be presenting with psoas abscess. What is psoas abscess? Again, one of the common mode of presentation. So within the psoas region, there will be abscess formation. So generally suggests that a patient is having this port spine. So this is the appearance. You can note down, completely destroying the bone. This is one of the typical presentation of port spine. one of the typical presentation of pot spine. So what are the other organs? It can affect adrenals, manifested as hypoadrenalism or Addison's disease, or it will affect testis, causing epididymoorchitis, presenting with the epididymoorchitis, or maybe it will produces TB peritonitis, manifesting as TB peritonitis, or tubercular salpingitis, or tubercular endometritis. Almost every organ we can get within this tuberculosis. Even prostate, we can make out tubercular prostatitis. Almost every organ is affected by this tuberculosis. Tell me the types of tuberculosis now. Okay. You get the chocolate if you tell the answer. See, there are 3 diagrams are there. You are supposed to interpret. Say dairy milk chocolate is here only.
Meningitis tuberculosis.
Okay, that is fine. That is what about one picture?
Hey, Shatalam, CBSE topper.
Okay, so this is in a recent newspaper. So this was on the famous news TB claims. One at 2011 CBSE class 2 topper. He suffered from TB meningitis. So that too it is because of multi-drug resistance. So multi-drug resistance. He is a CBSE topper. And what is that? Problem. What is this? Lymphocyte. I am keeping chocolate with myself. Okay, thank you.